Axiom's success over the 21 years we've been in business has been as a remote provider. And what we found is that gave us the ability to scale across the United States in any location. So if an employer was in many cities and many locations, it didn't require an Axiom presence to be physically in that location. We could support injuries, we can support other services remotely, and we've been incredibly successful doing that. What we found though is during the COVID pandemic that we've been experiencing, employers needed to bring services to their employees. As we thought about the reopening of certain industries, as you consider the health and wellness of employees in the workplace while dealing with a pandemic and infectious disease, they were requiring on-site services in a new way. So one of the things Axiom has done is to be able to provide some of those same services we did remotely there on site for some of these industries. For example, the television and movie production industry, there are critical roles that will help a production remain operational. And Axiom's been able to provide some of those roles on site, such as a health and safety supervisor and nurse testing administrator. Testing itself has been something that's been a bit of a roller coaster in the United States for COVID. Supply and demand has been a major challenge. And if there is a requirement to have a testing protocol for a company or a production to remain operational, Axiom has been able to help support that because we've been able to source various means of getting the labs to the site. We're able to make sure that the testing protocol is administered appropriately and that those employees that are on a site or on a production are able to do that as healthfully and as safely as possible. Yes, I think that this is a bit of it sometimes swings. I think that historically the way occupational health was delivered was on site, and there was this company doctor and company nurses, and that was a model, a very specific model, but it was usually used by manufacturing sites and your traditional heavy industry sites. Today what we're seeing is there's been a crossover between occupational health and then personal health. And employers are now more interested because they realize that if they help their employees stay healthy, they keep their teams productive, they're able to continue operations even during a pandemic. There's a level of trust that you can gain by having on-site services and people there delivering the services to a company. So by doing this and bringing the service directly to an organization, to their workforce, you're ensuring that the employees get the health and the wellness focus that they need and continuing those operations as much as possible.